Hi, this is Dr. Chet Rihal. Today my guest is Dr. Faris Tamimi, who is a cardiologist in our division, but also the director of the Mayo Clinic Center for Social Media. Faris, good morning, welcome.
Good morning, thank you for having me, Chet.
Faris, tell us why physicians should be interested in using social media in our practices and with our staff.
Fundamentally, social media represents the domain our patients are in right now. And by our patients, I mean everyone, including those over the age of 65, 42% at present in the United States. We're talking about 110 billion minutes worldwide spent on a daily basis. On average, worldwide, 6 hours per day are spent in these platforms. And if you look at their use, not only is it social, but the majority of time they're talking about healthcare information. We have an obligation and an opportunity that's profound by occupying the space strategically.
By social, what do you mean by social media? You don't mean just internet, right? Just define what social media is.
Social media refers to engagement that occurs. Now, when you look for opportunities in your operation for social media tools to be utilized, what you want to see are three different things. People separated by time, separated by geography, and separated by the need to work on a common construct, archetype, or meme. Social media lets you do that, lets you bring people together to do that. It includes microblogs like Twitter, it includes blogging, Facebook, YouTube, video blogs, podcasting. What it represents is a fundamental shift in how we approach engagement, and it's occurring online right now.
So what about things like confidentiality and HIPAA, and how do we deal with those type of things in the new world?
So fundamentally, the errors that occur in social platforms are the same that have always occurred. Social media doesn't create new errors. What it does is it advertises to a much larger auditorium. And I think people should view this as the fundamental mores we use in a small town engagement and apply those to an online environment. You should be professional, you should be respectful. You should never practice on the internet no matter how good your intent to do so. That's not the purpose of this domain. For example, I may be asked on Twitter about ACE inhibitors and blood work, and I would say, I can't comment on your case, but in general, we recommend blood work obtained after beginning a new ACE inhibitor. So you can comment in a generic sense. The way you should think about social media, you don't lie, you don't pry, you don't cheat, because you can't delete, you don't steal, and you don't reveal. For all those 6 rules, you'll do perfectly fine.
I really like that, Faris. So can you give us some examples of where social media has brought patients together and physicians together in a very constructive manner?
Well, I could tell you some examples from practice. For example, we have a 4- and 6-year-old. We see our pediatrician every spring. Erin talks about how to pick a bike helmet. It should be a Y over the ears, flat against the forehead, 1 finger breadth beneath the chin strap. That's powerful content. Erin does that 5 to 10 times that week. Each conversation takes 5 minutes to do. If I put that same content, and we do on our YouTube channel for the Mayo Clinic, how many kids whose parents may not be able to get them to that conversation or get to a physician will have their life touched and saved by that good content? Now, from a marketing perspective, this isn't marketing, but if your community online views you as the resource of choice, when they're not ill, when they are ill, they'll come to you.
What are the common pitfalls, Faris?
The most common pitfall, the most common issue that I encounter are people who let risk-averse concerns preclude engagement. Your competitor is online. That's what I tell my care providers that I interact with. They're online right now, and your patients are online. And if you don't participate, that is the most risk-averse impact you can see.
One of the concerns that many physicians express is that we don't have time to keep up with the daily volume of paperwork and emails. How am I going to add tweeting with my patients? So how do you manage it, Faris?
So the key is to be strategic in how you do this. For example, I view a high-volume physician as having 5 tweets per day, of which 2 can be retweets, meaning you saw something else interesting you're going to comment on, and 3 are self-generated, ideally 120 characters or less. When I prepare a talk, I'll have a bullet point slide at the end with 4 to 6 bullet points. Each bullet point is 120 characters or less. Those are my tweets for that talk. So if you think about what you're doing and do it strategically, you'll find it very easy to do. And frankly, this is not something that you should view as accessory work. This is part of your strategy right now. This is part of how we engage right now. This is how people communicate right now. So I tell providers, this is where your patients are. This is where you can do the most good. Your impact is magnified profoundly. You need to be in this space.
So what's the best way to break into this space?
Frankly, I view Twitter as a gateway drug. I think all of us need to have a personal online brand identity, a core brand identity. I would build it on Twitter. Now, I believe everyone should have understanding of the tools in the tool set, but not competency. What I would like to see is a group of super users for each division or department. that I engage with. But I want everyone to be aware of the tools. When the opportunity arises, they can execute on that opportunity. But as far as personal brand identification, I think Twitter is where I would start.
That's fantastic, Ferris. Thank you so much. This has been a fascinating conversation. I'm sure our audience has gotten a lot out of it.
Thank you for having me. I appreciate it.
So my guest today has been Dr. Ferris Tamimi, the medical director of the Mayo Clinic Center for Social Media. And I hope you found his comments as engaging and fascinating as I did. Thank you very much.